Yes.
Welcome to European Wellness, KK. So, what was your initial assessment of Lee Jiaqi's condition before starting the PSC treatment?
Okay, so Jiaqi is my first autism case. The reason why I wanted to introduce her to European Wellness Center for Autism PSC treatment, that is targeted brain progenitor stem cell, is because it's actually the whole family has been accepted those like MO treatments, and they're being respond very well, but just not Jiaqi. And Jiaqi is a very serious kind of autism case. Not until I know her, I didn't know that this kind of serious or severe type kind of autism is like this. She couldn't stop eating. Whenever she saw something that she really likes, she would kind of eat continuously and non-stop. And she couldn't sleep. So during that whole week, there would be 5 to 6 days, she would stay up like whole night and just making noise. And then also she couldn't really do learning, and then couldn't follow order. And she got the habit of making noise all the time, and she couldn't do eye contact. So that's the baseline of this patient before the treatment. And in Taiwan, we try to give her some of this exosome or this targeted organ exosome, but it doesn't really help her a lot. And so when I attend, Professor Mike's seminar in Kintabali, and they mentioned there's a session mentioned about like Dr. Mike, they do lots of this kind of autism case treatment by PSC cell. And in the very first beginning about me to after this lecture, 80% I think it's possible, but when they show their result about Down syndrome and autism cases, actually there's still like 20% of me, I feel doubted about it. Because along this whole history of me practicing as as a physician doctor, I don't think it's possible, especially for Down syndrome and this. And so, but I've been witness, for the suffering as a parent and mother to be autism cases. So I talked to Jiaqi's mother, because she's been a good friend of mine. I said, why not we do a gambling, okay? We do one-time gambling, and let us see what happened, okay? So we two together, we brought Jiaqi here for the first time of the cell treatment. And Professor Mike has been very supportive, and all the doctors here and staff here. So after the first treatment, we've been witness many changes about Jiaqi. The first things, this habit of non-stop eating has been stopped. So she can started to kind of accept that, okay, it's enough of eating, and then she can stop. I think that is a big milestone. And second things, she started to smile. I never seen her smile before cell treatment. And then she started to smile. And then the other things is that before this treatment, she never let us know like she knows anybody, recognize anybody. But there is one time I was in their house, and her mom, told her, hey, Jiaqi, look who is here. It's Jennifer, it's Dr. Lee. And she looked at me and said hi. So that is a big milestone too. I feel very impressive and touched. And then one thing's very amazing is like, before the treatment, she can't really sleep well. And then, but after that, we brought one of the biosleep machine back to home to go with us after treatment. And now she can at least, after the first treatment, she can at least sleep for 3 to 4 days for good sleep in 1 week. Of course, after second treatment, she can sleep like 5 to 6 days for good sleep now. So I think for this one, at least the mother can take care of her, and sometimes the nanny can willing to take care of her now. So that's a big step, for this cell treatment. And I want to say something about this PSC treatment. Is like, I never think about any medical procedure or any medicine that can actually help with this autism case. Because everybody think it's genetic or it happened inside the mother's womb. And if you ask any doctor, there won't be any solution for this. But I'm pretty touched and really thankful for Professor Mike, what you do to autism case.
I think we continue on.
Okay.
Yeah, we can do it later.
So having said that, how do you think, as you mentioned, that from a clinical perspective, the progress you have seen over the past 2 years has been miraculous, right? And how do you see regenerative and cellular therapy shaping the future of autism care?
Okay. For these 2 years, whenever I talk about the Jiaqi's story to my colleagues or other doctors, actually other doctors always, just first impression on their face is like, really? Okay, so I think the most important things, for this is we have to spread out this story. And it's not only our story, we have to spread out the other stories, because for the first time after I had this lecture from Professor Mike about autism treatment, with PSC cells, it's like when I fly back to Taiwan, I talk to the parents. The parents wanted me to explain them more, so I tried to explain about this whole targeted brain PSC cell treatment. And the first thing they said, how many cases you think they're being successfully treated? Okay, that's the first question. And number 2 is Jiaqi is already 33, okay? She is an adulted type kind of autism, and they're treating the kids. So is it possible that we can get any progression for that? That's the second question. Third is how good she could be after those treatments, okay? So I think for the first step, for those parents, they want to take the step to accept this kind of very pioneer kind of treatment. The things they want to know is about experiences and this results and the expectation. So I try my best to be a bridge to explain to them, and also I try to help them to fly here, and I've been here as a company and also a consulting doctor to help them to make the whole procedure smooth. And if you ask me, what we can do to make all those parents so that they can get those treatment or procedures more smoothly, I think spread out the story would be very important. And we also can provide them those professional background information, so about the expectation. But what I want to say is for autism case, it's so complicated. As for me, there'll be several autism parents they're asking me about if they'll be beneficial from those treatments. But when I ask them about their kids, I'm very surprisingly to know that they're all different. They're very complicated. So Jiaqi's case is very severe type of we have like, mild kind type of, we got different age, we got different gender. So still, this whole center, European Wellness Center, is by far the most experienced, center I've ever seen. They have more of the case. So I think, yeah, we were very lucky, to be treated like here.
Next question is, what has this journey meant to you personally as a doctor?
Okay, so back to Florida. I met Mike in Florida, Miami, in a conference happening. It's a stem cell conference, and he gave a lecture about those progenitor stem cell treatment, and also this MO product, and then also the exosome treatment. And that is about like 6 to 7 years ago. And that started myself with the journey for stem cells and exosome. Actually, like 23 years ago, I studied neuronal stem cell in UCLA. And back to that time, we don't have any products. There's only theory and experiments. But 7 years ago, when I met Mike, we already have product that we can actually use on human bodies. So I started to use it, on my own. And turns out I like it very much, because actually, I already passed the middle age, but I don't want to say how old I am. But I got a son. He's already 23 years old. So it helps me with to keep my young look, and it helped me to keep energetic, and also because I give lectures in a conference all the time, and there's a symptom that is really bothering me. It's like if I give a talk and in the middle of it, I forgot where I am. Okay, but after the injection for MO products, I get back to this young feeling, and the thinking, gets sharp again. That is, I like it very much. So this whole journey is not only for my patient, it's about myself too. So European Wellness Center is like a very credential and a trustable institute. So my own thesis is I can only provide those products that I want to do with myself to my patient. So it's fulfill this whole belief and this faith, of my own treatment and practice protocol.
One last question is,
Yes.
In your medical opinion, how pivotal has Professor Mike Chan and European Wellness been to Li Jiaqi progress?
Excuse me?
In your medical opinion, in
Yes.
summary,
Yes.
how important is Professor Mike Chan protocol has been to Li Jiaqi's progress?
Okay. So back to the first time we do the PSC treatment for Jiaqi, and Professor Mike sent me a questionnaire, a very professional questionnaire to us. So then he asked us to fill out those questionnaire, and in that way, I started to figure out there's a method that Mike want to know what's this area inside the brain that could probably we can inject the stem cell inside there and make it nestling or homing back to treat it. So I think a good evaluation and those questionnaire is so important. Do you want to? Okay.
It can be edited, no problem.
Okay.
I think you did it very naturally.
Yeah. This is a true story.
Very natural.
This
It's a
is
different
a
story, yeah.
This is a true story, very touching. So, back to the first treatments, we do the questionnaire very seriously. And so, as a doctor myself, I learned how to evaluate a patient with like autism problem. And so, every treatment afterward, Professor Mike's been so care about the results, and he's been so considering and so warm and to talk to us, and also he follows every time with the questionnaire and prescribe the cell. So that is very interesting, because like I saw back to 23 years ago when I'm in UCLA for those neuronal stem cell research, we don't see any future of real treatments. But for now, we can see the twin lights, this future. About this, actually you can prescribe cells, to do something. So it's very inspiring, because like if we are walking on some route, some people already built up the road, which is nice, but we are on a road, we're walking on a road and a journey that probably only Professor Mike ever been there before. So I'm pretty honored, and I'm pretty happy, to walk after him or along with him, and then to witness this whole very inspiring and pioneer kind of treatment. So every time I fly back to KK, to Kinabalu, and when I visit this center, I saw progression, I saw improvement, and every time I get very lots of inspiration, from this center. So if you ask me, and inspired by this center, it's like I really, really hope we can have a French center or French institute in Taiwan, so that our patients, they don't have to fly so far and suffering, because if you want to get those autism case on the flights, that is a big thing. And then we're so lucky, we're being blessed by God, so we can be here. And then, but if in the future we can have this kind of institute or center in Taiwan, and we can benefit all those autism cases in Taiwan, that would be a real bless from God.
Yes, Jennifer, do it fast. Build up European wellness. We apply the same concept in Taiwan.
Yeah.
We will support you all the way.
Yeah. So
Yeah, thank
that's
you.
his English edition.
Yeah.
So we do
But for
the
Chinese,
Mandarin.
we do subtitle and translation.
Yeah, but then you want to hear her voice in Mandarin. Right? Perhaps you want to repeat some of the questions in Mandarin.
Yeah.
In a different way.
Yeah, or in a different one. Natasha, you can